I think when they're little.
They're lamb hearts.
Yeah, they're lamb hearts.
Oh.
So this is actually huge for, it's almost like a cow heart. But this is the pericardium. Remember, it's a closed sac of fluid. So imagine a balloon full of fluid that you push your fist into. Where that balloon is touching your fist and it adheres to it is going to be the visceral layer of the membrane, in this case the visceral pericardium, and then it's reflected off the surface, forming the outer layer of the balloon, which is the parietal. So that's what you're seeing out here. This has more adipose tissue than I've seen with most. All right? So I cut it, and now my hand is in the pericardial cavity. So if I completely undo it, here's the heart, and the pericardium is attached at the great vessels. I grew up with banana trees, so it always reminds me of a banana bud, the way it develops. But notice how the inside of the parietal pericardium is smooth and slippery. That's continuous with the surface of the heart. So covering the surface of the heart is a simple squamous epithelium as well. So creating a watery serous fluid. This is visceral pericardium. And so now I'm going to let this fall back and wrap over my hand. This is parietal serous pericardium. And my hand is in the pericardial cavity that was cut open. Okay? So I'll put this back in the fridge. I'll bring it back out again when we do lab so that you can examine it and understand a pericardium a little bit better. And I'm going to diagram it on the board. You have the image of this. I'm going to have it on the screen on in your lecture notes. The key difference between visceral and parietal pericardium and visceral and parietal pleura is there is that fatty layer on the outside and a tougher layer of connective tissue. Because not the pericardium shares a role with the pleura to create a slippery surface of lubrication, so your lungs expand when you breathe and collapse. And if we didn't have that, it would be irritating to slide against the walls of a thoracic cavity. So that provides a lubrication. So as the heart fills with blood and contracts, that also provides a lubrication. But the heart doesn't have the chest wall. It has just the pericardium. And so this forms another function to limit the degree to which the heart can expand. Because if you recall in 430, we had an optimum overlapping of actin and myosin for our force of contraction. If they overlapped too much, it couldn't contract a lot. And if they barely overlapped, the actin myosin heads couldn't grab onto the actin. So if we have the heart expanding too much as it fills with blood, then it can't contract enough to push that blood out. And so the pericardium functions to limit how much that heart can expand.
Does that help regulate the blood pressure?
With the cardiac output. Do you have this diagram on your lecture notes? And I'm going to diagram it on the board as well. So the atria of the heart has been cut, exposing the wall of the heart. Right here, where the visceral pericardium is turning back on itself to become parietal pericardium. And before I diagram that, let me illustrate it on the board again with that balloon.
Can you say that one more time, Professor?
I'm going to diagram it and then I'll go back there. So here is the heart. And the pericardium is like a balloon that has been, the heart is like your fist. And we took a balloon and pushed the heart into it. So if we started with a balloon like this, and you push the heart into it, And we keep pushing. So where the balloon is on the surface, you push your hand into that balloon. Where it's attached to that is the visceral pericardium. And where it's not attached is parietal pericardium. And where it's reflected back is on the great vessels. So the diagram that I'm going to follow with you on from the screen is cutting right through here. So we're going to see visceral pericardium, and we're going to see parietal pericardium. Okay? That's what you're seeing right here. Here's the visceral pericardium. It's reflected back. And this is parietal pericardium. Everybody with me? Okay. So let's, here's a section of the atrial wall, which is muscle. That's cardiac muscle that we'll be looking at tomorrow in lecture and talking about different types of cardiac. The inner chamber of the heart, as you'll see when you look at your sheep hearts in dissection today, is covered with a simple squamous epithelial lining attached to the myocardium with connective tissue. So the simple squamous epithelium I'm drawing with a dotted line. It's a serous fluid, and it's continuous with the simple squamous epithelium lining all of our blood vessels.
And that's the endocardium?
It's going to be the endocardium, yeah. That's attached to the inner lining of the heart with connective tissue. Primarily loose, irregular, but there is some dense, irregular. This would be loose connective tissue. And some dense. And that lining, this would be the left atrium. So this lining is known as the endocardium. More like the endometrium we talked about with the uterus than the endomysium or endoneurium of nerves. Okay. So in the uterus, the endometrium was simple columnar epithelium and connective tissue. The endocardium is simple squamous epithelium and connective tissue attached to the muscle, covering all of the components of the chambers of the heart. So now we're going to talk about the pericardium. All right, so the inner lining is endocardium. Then we have the muscle, which is myocardium. And this is cardiac muscle. And then we have the pericardium. Visceral pericardium is going to be attached to the surface of the heart with loose connective tissue. The surface is simple squamous. Whoops, dotted line here. Sorry. Simple squamous epithelium. And then that is reflected off, forming the pericardial cavity. So just what I drew up here. And the loose connective tissue comes off as well. Now if this was the pleura, this layer would be attached via the connective tissue to the body wall and forms parietal pleura. Right? But it's out in space. It's not attached to the body wall. So this portion right here attached to the heart wall is identified as visceral, serous, pericardium. Viscera meaning organ. Okay? So when you look at your models and you touch the surface of that, that is representing the visceral serous pericardium. Here is the plasticized heart. The parietal layer has been cut and pulled up, but this layer right here is the visceral serous pericardium. shorter term for that fits in with our endocardium and myocardium. And the alternate term for visceral serous is epicardium. That takes the place of all three words. So if that's visceral serous pericardium, then this outer layer, the same as this outer layer, is going to be the parietal serous pericardium. Formed of the same tissue. Simple squamous epithelium and loose to dense, irregular connective tissue. But that's not very sturdy. Remember I talked about the additional role of keeping the heart from expanding too much? And so to the parietal layer, not to the visceral layer, to the parietal layer we added extra thickness, all that adipose tissue that you saw, plus dense irregular. And that toughens up that outer layer. So we have an outer layer of additional collagen fibers and adipose that makes it very tough. And so just this layer is identified as the parietal fibrous pericardium. And I don't care if you switch the terms around and call it fibrous parietal, as long as you recognize those components. So to illustrate, I should have worn a black silk shirt. My body's the heart, not the uterus this time. Okay, so I'm the heart. This shirt is attached to my body. This would be the visceral serous pericardium. All right? Pericardial cavity. The lining of my jacket is continuous with my shirt, should be the same material, is the parietal serous pericardium. And this tough outer layer fused to it is the parietal fibrous pericardium. Okay? So that's attached here, the base, but then free. So when I cut it open, then you can see the pericardial cavity that contains serous fluid. Okay? So again, if that still seems a little unclear, come look at the large heart that I showed you a few minutes ago during lab. So we have then the three layers of the heart wall itself would be the epicardium, or the visceral serous pericardium, the myocardium, and the endocardium. Blood would be in contact with the endocardium, and serous fluid in contact with both the visceral serous and the parietal serous pericardium.
Can you say that one more time?
Okay.
The last part.
Blood is in contact with
Endocardium.
the endocardium, because it's in the chamber of the heart. Serous fluid would be in contact with the visceral serous and parietal serous pericardium. So this space would be the pericardial cavity. Now on page 10, I have a couple of terms, pericarditis and cardiac tamponade. Anything with itis means what? Inflammation. It doesn't have to be an infection, okay? It can just be an inflammation. For example, when I was teaching in a college back east, the chair of our chemistry department was just barely 30 and still thought of himself as a college guy. He would play soccer on Friday afternoons with the college guys. And one Friday afternoon, he and an opposing player came chest to chest like that. Both fell down, got up, kept playing. But the next morning, Saturday morning, he was having chest pains. And his dad had had several heart attacks. So he thought, I must be having a heart attack. He thought, you know, if I exercise a little bit and I'm having a heart attack, it will hurt worse. So he started doing jumping jacks. And it hurt, but it didn't hurt worse. I said, well, if I run up and down my stairs, and if I'm having a heart attack, it will hurt worse. That didn't change anything. So he said, I live on a hill. If I run up and down my hill, that will, determine. Well, he kept having the pain, but it wasn't getting worse, so he called some friends and they took him to the hospital. And what had happened was when he hit chest to chest with that other opposing player, it pushed the sternum against his heart, which pushed the parietal peritoneum against the visceral and sheared off that simple squamous lining. And so that was the inflammatory process. Additional fluid was secreted in, and that was where the chest pain was coming from. So they kept him a few days, gave him some antibiotics, and said, the next time you're feeling you have chest pain, don't kill yourself trying to prove it's a heart attack. Come on in. Cardiac tamponade is similar, that fluid that was in his pericardial cavity, excess fluid, whether it be blood or serous fluid or other fluid, as it causes this space to swell. So let's say we have excess fluid here. The parietal fibrous pericardium can't stretch. Okay, so that's going to stay the same. So when we have excess fluid in the pericardial cavity, what's going to be restricted is the size of the heart. And you're going to have a greater volume in the pericardial cavity and less expansion of the heart. So it's going to have to beat faster to try to get the same volume out. All right? And so the pulse may become weaker because not as much blood is being pumped out, but in trying to keep the same volume with a smaller per minute with a smaller volume per stroke, it's going to beat faster. And hence you get the weak, thready pulse that often happens with bleeding or low blood volume. There was this, who was it? Steve Irwin, that was swimming and got the stingray tip in his heart.
Should have left there.
Should have left it there. It happened a few months later to a guy in Florida in a boat with his granddaughter and her friend, and a stingray landed in the boat and stuck him in the chest, and he left it there and got himself back to shore. I was working at a hospital a couple years after this happened. A woman who was 6 months pregnant was admitted with pneumonia. And severe enough to be admitted, they put in a subclavian line. You have large subclavian veins that go under the clavicle. And if they need to add additional fluid, or if they need to add pre-digested food, parental alimentation, they'll put it in there. And she kept getting worse and worse and worse. They finally took x-rays. She was developing congestive heart failure and pulmonary edema. The needle had been passed through the subclavian vein into her pericardial cavity. And the intravenous fluid was going into her pericardial cavity. And so that was just filling this up and making this, she ended up dying. They lost both her and the baby. And so it was a case of cardiac tamponade, but not blood, as in a bullet or a stab wound, stingray. It was the IV needle coming in here, and then just, putting in the IV fluid into that space.
And they're still working?
I
I doubt it.
doubt it. So here's a view of open, well, the heart hasn't been opened yet, but the pericardial cavity has been opened. So the hands, this surface here, would be touching the visceral serous pericardium. Okay? So we'll be looking at a few slides of cardiac muscle next week. But again, the outer layer, the visceral serous pericardium, can be identified as epicardium. So it's going to have a surface, simple squamous, a lot of adipose tissue as we saw, and then right under the epithelium, something loose, but a lot of dits. Cardiac muscle. We didn't get to look at this in 4:30, but we'll look at it next week. You may have looked at it in 4:30. And then the endocardium, here's cardiac muscle, and then that's thinner. Not as thick as the epicardium. I'm not going to ask you to differentiate from the microscope slide between endo and epi. All right, don't worry about that. That's a medical histology level concern. Okay, so let's actually take a short break here.